So good afternoon. Just to start out first, that from now on we will be wearing our masks on air as per the order of the Bangkok Metropolitan Administration, as well as to set as an example on screen for our audiences of the importance of wearing masks. So we'll be wearing masks while we do all the presentations in the CCSA briefings from now on. So to date, as of today, we have the number 1.2 million. 1.2 million vaccines have already been inoculated in Thailand, and the number is growing according to our vaccination plan, hoping that the plan will continue, be a strong plan, and will be effective in the application in terms of the inoculations of people in Thailand as we move forward in the months ahead. So for the numbers today, Tuesday, the 27th of April 2021, we have some numbers for you. New confirmed case is 2,179. Out of that number, 2,149 cases are from local transmission, practically the majority. 25 cases from active case finding and 5 cases from within the state quarantine system. Most of the new cases found today are in Bangkok with 993, in Nonthaburi province 149, Samut Prakan province 93, Pathum Thani province 93, and Chonburi province at 80. We have currently 25,973 active cases still being treated in medical facilities to date. And out of this number, there are 628 cases that are classified as in critical condition. Out of the 628 cases of critical condition, 169 cases are on ventilators. So 169 is a part of the 628 critical condition cases. 169 ventilators being used right now. Now the tally in terms of the new recoveries, to date we have 1,958 new recoveries, as compared to the new confirmed case for today, 2,179. And as you see on screen there, the English language infographic, active cases over 25,000. We have recorded for today quite a new high in terms of fatalities. Unfortunately, 15 new fatalities recorded for today, making the cumulative number of fatalities in Thailand now standing at 163. These 15 new fatalities, I'll just go over the general picture of these cases. Out of this 15, 9 new fatalities were found in Bangkok, 2 in Nakhon Sawan province, that makes 11, and the remaining 4 is 1 new fatality each in the provinces of Chayapum, Phetburi, Samut Prakan, and Saraburi. Now, most of these fatalities had pre-existing conditions such as diabetes, cancer, heart disease, and asthma. The current fatality rate of the current outbreak that we have is 0.22%. 0.22% fatality rate. The Ministry of Public Health also revealed that more than 55% of fatalities during this current outbreak are aged 60 years and older. More than half of the fatalities are 60 years and older. And just some additional information as addressed by Dr. Tweesin just now regarding beds. Now, on the 25th of April, we recorded that there had been 1,182 persons admitted to the hospitals for COVID cases. Now, this is a result of the coordination of various agencies, the hotlines, actually 5 main agencies and the hotlines that people have been in contact with. We've improved that to be more effective, more integrated, hotlines such as 1668, 1669. And as a result of this coordination, 1,182 persons have been admitted and found hospital beds, so to speak, in order to seek treatment for their COVID positive detection. On the 26th of April, yesterday actually, there remain 201 persons who are still awaiting for beds, and we will be addressing this bottleneck as soon as possible. The numbers of the persons still awaiting for hospital beds is actually not as high as in the past days. We've been able to clear most of it already. So currently 201 persons still awaiting for hospital bed relocation. Just some additional issues. Firstly, regarding favipiravir pills. So yesterday, the Ministry of Public Health received 2 million favipiravir antiviral drug pills ordered from Japan, and this is recommended as a treatment for patients suffering from serious symptoms also, such as pneumonia or with high risk factors, uncontrollable diabetes, lung problems, or old age. And the government pharmaceutical organization has already distributed these pills that arrived yesterday to various hospitals in accordance with the allocation plan of the Public Health Emergency Operations Center, or the Public Health EOC. And in May, next month, a few days' time from now, 1 million more pills of the antiviral drug will arrive in Thailand, raising the total of the newly acquired drug to 3 million pills. The Ministry of Public Health will procure 2 to 3 million more of these pills to assure that there are sufficient pills to treat all patients during the current outbreak. So that's about the pills, favipiravir antiviral drug pills. Now moving to the vaccination, national vaccination plan, just to update the audience here that yesterday the Prime Minister chaired a meeting with members of the Cabinet and advisors to discuss further on the distribution plan of the vaccine. So it has been decided that the government will be adopting a single command system to improve the efficiency of the national vaccination drive and cooperate with the private agencies. That discussion has begun, as you would know, to ensure broad distribution of the vaccine doses. The Prime Minister will also be meeting further with the private sector tomorrow to discuss about the venues that could be used as vaccine distribution centers. A proactive vaccination plan with the assistance of the private sector will be put in place to ease the burden on the public health system. The government will also discuss about the progress of the procurement vaccines for businesses to inoculate for their employees. The Prime Minister also said that he will be doing everything in his power to procure more doses to support the drive, with a target to buy 10 to 15 million doses a month. Aside from the plan that has already been planned, the government also aiming to inoculate about 30 million people over the next 3 months and 50 million people by the end of the year. Regarding the news that a 24-year-old woman had suddenly passed away after receiving a vaccine, the Health Ministry will be performing, as soon as possible, the autopsy to determine the cause of death. The Disease Control Department has also said that it is too early to say whether the vaccine is actually the factor. The case has also been submitted to the Ministry's Committee on Adverse Incidents following immunization for further investigation. On disease control measures, just to update that the CCSA meeting today, the Health Ministry proposed that the disease control measures should be tightened even further in the provinces. And as you see, there had been many provinces that had announced already tighter control measures, be it the fines for not wearing masks. Now, in this proposal, the Public Health Ministry had proposed that 6 provinces will be categorized as maximum and strict control areas, 55 provinces in the maximum controlled area, and the other 16 will be in the controlled area. So just sort of like a reconfiguration of the maximum controlled area, dependent on the situation that we have now, the fluid situation that we have now in various provinces. The Ministry of Public Health has also proposed, and mind you, this is a proposal, that all international travelers obtain the certificates of entry after May the 1st would have to undergo a 14-day quarantine period, increasing the quarantine period from the current 10-day period. This is a proposal first, and all of these proposals regarding the new categorization and the quarantine period will be discussed at the General CCSA meeting on Thursday, which the Prime Minister will be chairing. So these just a heads up on the developments that we have in order to tighten the control according to the daily situation. But this is to be discussed, and if approved, that will be done on this Thursday, during the General CCSA meeting. So just to remind that the current disease control measures imposed differently in each province. Nationwide, there are now 5 provinces that are asking for cooperation from residents to stay home during nighttime. And these provinces, you see that on screen there. I won't read the province's name. And with the times as well in which the residents are required to stay at home during nighttime, 2100 or 2200 or 2300 hours onwards until 4 a.m. in the morning. Now further, as you would know already, mask wearing is now compulsory, mandatory in at least 54 provinces nationwide. So please don't forget to wear your mask, these very important masks, as you leave your house and travel in public areas. There was also, of course, a release regarding wearing masks in cars, in private vehicles, which is required unless you are traveling alone, only one person. But if you're traveling with 2 persons, or there's 2 persons in the car, even if it's your family members, then masks are required. Also, in addition, a tip from the Department of Disease Control about how to wear fabric masks in a safe way. You have that on screen, courtesy of the Public Relations Department. Just a simple guide: wash your hands with soap or alcohol before and after touching the mask. Before and after touching the mask, wear the mask close to the face, without gaps on the side, tightly. Do not wear a mask under your nose or chin, and do not remove the mask within 1 meter away from others. Now, you may have seen in the news, and I'd like to mention this just briefly before I end today, is that wearing masks is very, very important, and you can be fined in many provinces, including in Bangkok. Now, it was in the news yesterday that the Prime Minister was also fined for forgetting to wear a mask during a meeting outside of his own home, attending a meeting, and he forgot to wear a mask. So he was actually fined for that. Now this, I would take it as a very, very good example, leading by example, that enforcement of the important rules, such as wearing masks, applies to everybody. I mean, no matter who you are, no matter in what situation you are, in what location you are, it applies to you. It doesn't matter what nationality you are as well. So it's very important. Even the Prime Minister has to abide by these very important life-saving rules and regulations. So just to close on that, we all should lead by example. Hopefully in our briefings, we'll be not forgetting to wear masks like this as we go on air, as we go on screen every day. I like to lead by example as well. I like to showcase, have a visual out for you that I'm wearing masks all the time. So from now on, you'll be seeing us wear masks, wearing masks on air, or while we travel, being in private cars, or working in offices, in buildings. As long as I'm not alone, I'll be wearing a mask. So better get a good supply of that. So thank you very much for your attention today. This is the information that I have. We'll See you again tomorrow. We'll come up with a lot of important information update to you as we lead the effort towards eradicating COVID and towards the meeting that we'll be having, the very important meeting that we'll be having on Thursday, the general CCSA meeting. So thank you very much, and Sawasdee krap.